Welcome everyone to another wonderful episode here at Doctors of Podiatry. There you have it. Okay. We have a young patient who has presented to our office today with not one, not two, but 3 lesions on the plantar aspect of the left foot. The patient has had these lesions for quite some time, I assume, right? Yep. Okay. And you know, what we're trying to basically do is determine whether these are simple calluses, corns, versus possibility of plantar wart, plantar verruca. So to further evaluate / investigate, we're going to go ahead and first debride the lesions, okay? And that's essentially what we're going to go ahead and do today. Obviously, these are not just any ordinary lesions. They're pretty robust, right? So without further ado, let's get to work. Okay, so we're going to be very, very careful here. The good old saying, the callus never lies, right? Wherever we see corn, callus, lesion, there's what? Pressure, right? So it is a peculiar little location, right? Just in, tucked underneath each toe individually, but we have seen it before. Differential diagnoses. Sometimes we'll have either, again, a corn callus as a result of pressure, number 1. Number 2, possible plantar verruca. Number 3, a possible eccrine paroma. Dr. Wagner, what is that? Clogged sweat glands. You don't have to talk, patient. Do your feet sweat a lot?
Average.
Average, okay. But you are very active, though. Exercise-wise?
I try to exercise 3 times a week.
Yeah.
But at home, it's not like I'm getting super sweaty. Not
Gotcha.
at the gym. I'm not using steam room or anything like that, or common showers.
Super. I don't think this is a wart.
Right.
Okay. However, we're going to talk in a second. Actually, let's start with this one here. There are several ways, right, that we can treat these lesions. Obviously, what we're trying to basically do first is identify what it is, so then we can actually cater a specific treatment plan for the problem. In some cases, we've used, and this particular patient is a clinician, very, very in tune with some of the treatments that we use for these lesions. Now, the patient is very familiar with canthrone, aka the Beetlejuice. The canthrone, historically we use canthrone for the treatment of plantar warts. The patient does have a past medical history in respect to warts. We have used the canthrone in the past. Now, the interesting thing about canthrone is that not only can we use it for plantar warts, but we also use it for other clinical presentations. So there's a possibility that we may go ahead and apply a little bit of canthrone, okay, to essentially enucleate, right? Just try to relax her a little bit. There we go. Just try to enucleate the core, so to speak. This is an area where it's mostly fat, not necessarily, structure bone. So again, a little bit atypical, but we have seen it. And as you can see here, everyone, these are pretty deep. They're deep. They're quote unquote down to the core, right? So this one's probably, the one in the middle is probably the most superficial one. Okay. And everyone can see here, the most medial one has definitely that central core, so to speak. course, this is going to provide a significant amount of pain relief today, but if we don't really do a whole, anything about it, there's a I would say a high probability of recurrence. And if I'm not mistaken, you said you tried pumice?
No, I was parrying with my own scalpel.
Oh, so the doctor was also becoming, the patient was also becoming the doctor. A little bathroom surgery, trying to enucleate these lesions. Take the pressure off, right. And I guess it was sort of working, right?
It would last me at least a week, maybe 2 weeks.
Which is not a lot.
No.
Yeah, but there are no initial signs of verrucous tissue.
Right.
Yeah, that's definitely great news. Talk to me. Are you going to say something?
No.
Okay.
Just deep in thought at that moment.
Okay. How does that feel? No difference per se?
Yeah, as long as I'm not standing, I don't, it doesn't hurt. So I feel no difference, and you not caused me any discomfort in terms of the procedure so far.
Good.
I'm relieved that you're doing this. Problem with me doing it is I have a little radiculopathy from bad back, and so when I bend my foot to try to scalpel it myself, then I end up having a lot of leg pain, so I really am reluctant to do self-treatment.
Gotcha. Okay, super. So again, we were able to remove not one, not two, three. We nucleated these lesions here. And, we're going to go ahead and apply a little, not a whole lot, a little bit of the cantharum to see if it can help us chemically, we'll just say enucleate, debride the lesion. Hopefully that'll provide some pain relief. Okay, so now what we're going to go ahead and do, I have the beetle juice, the cantharum, right here, and then we're going to just apply a little bit here, tiny little bit here, and right in there. Okay. And again, this is not the magic bullet, so to speak. It is not. But let's, in my experience, I think that we should definitely try one, see how it goes. And depending on the progress, we may consider another one, okay?
Mm-hmm.
But again, I, in my expertise opinion, I don't think these are plantar warts, okay? We don't see the pinpoint bleeding. We know, we don't see the clinical signs of that clinical presentation, okay? So we will continue to do what we do, educate the world that these clinical presentations do exist, subsequent treatments. I'd like to take this opportunity to thank the patient for allowing us to do this. I think that this will definitely help the world to understand more of these clinical presentations, how we evaluate and subsequent treat them, of course. Okay, so as always, thank you for watching.